वेलकम टू दिस चैनल। मैं सब डॉक्टर टी एन डॉक्टर मॉडर्न मेडिकल साइंस मोटिवेशनल स्पीकर एंड लाइफ कोच। आज इस वीडियो में हम बात करेंगे साइकेट्रिक एग्जामिनेशन, जो कि हम लोगों का सब लोग जानते हैं MSc मेंटल स्टेटस एग्जामिनेशन। इसमें सबसे इम्पोर्टेंट एक पॉइंट आता है मोड एंड इफेक्ट। इसके बारे में इस वीडियो में हम बात करेंगे कि मोड क्या है, इफेक्ट क्या है। ना मोड अब देखेंगे, मोड इज सब्जेक्टिव, मतलब मोड विल बी टेल बाय द पेशेंट, will be told by the patient. It is a subjective phenomenon, where affect is objective phenomenon. मतलब we will watch or we will look at the patient whether what is the effect of this patient. Mood is told by the patient, effect is seen by the doctor. It's by the patient, and effect is by the doctor. Doctor can see, or therapist, you can say doctor or therapist. So you can see what is mood and what is the effect, and remember this effect starts with A, not E, right? So mood can be, mood क्या क्या हो सकता है? Mood can be either, mood can be patient may feel good, patient may feel bad, right? Now अगर mood good है, then we'll objectively we'll try to find out whether effect is good or not. If effect is good, then we call it euthemic, that is not normal, euthemic normal. Okay, now if mood is elevated, what we can see in mania, जहाँ पे mood बहुत ज़्यादा increase हो जाता है, mood elevated, okay, increased mood elevated in case of mania, where mood decrease in case of depression. Remember these two things. Mood, sometimes mood may be elevated in schizophrenia also. Now if it is good mood, then objectively we will see whether it is euthemic or not. If it is euthemic, that means it is normal. Now the effect can be constricted, euthemic, number one. Number two, it can be constricted. What we see, euthemic is normal, while constricted we can see in psychotic disorder like schizophrenia. Or it can be irritable or dysphoric. It also seen in schizophrenia and other psychiatric condition. Now we have to understand about the mood and effect, that whether mood and effect is congruent or not. Now what congruent, right? ENT, congruent or not. Now if patient say he feels good and objectively we see patient is euthemic, normal, then we can call it as congruent, right? We call it congruent. Now if say patient is saying that he feels very good, but if we see the effect is constricted, that means mood, whether it is good and effect is constricted, that means it is not going the same direction. Here it is good, here it is constricted, matlab bad. So in case it is not congruent, then we call it as incongruent, right? So we have to understand the mood is subjective phenomena by the patient, effect is objective phenomenon by the doctor or therapist, and mood can be he may feel good or bad, right? Or he will say okay. Then we have to see the effect whether it is going with the mood or not. If mood and effect is same, like mood is good and effect is euthemic, then we call it congruent. But if patient say he feels very good, but if you see his face is constricted, dysphoric or irritable, that means it is not going the same direction. In that case we will call it as incongruent, that is mood and effect is incongruent to each other. Thank you.